with Eli Lilly. And, my understanding is this is actually what Chris Christie got, similar to what you heard the president talk about, which was the drug from Regeneron. So this, when you couple this with Pfizer, it seems like a double dose of some positive news, Dr. Farber.
Absolutely. It's the best news we've heard in a long, long time. And finally, there's something positive to say. Yes, the Eli Lilly monoclonal antibody is a little bit different than the Regeneron, which is two monoclonal antibodies. But let's be very simple. These are very high titers of antibodies that have been made to the COVID virus, the spike gene. And what it is given is early on, as you said. It is not of any value once the patient is very sick in the hospital. It will not help critically ill people. Those studies have been abandoned because of lack of efficacy. Like other prophylactic and early treatments with monoclonal antibodies and other diseases, give it early before the patient gets sick, and it decreases the risk of requiring hospitalization and going on to getting the bad sequelae of COVID-19.
So does this fill a gap in treatment? Because this is, the people who aren't in the hospital, and so far it's kind of been like, stay home.
Yes, absolutely. And this is a great news. Unfortunately, the downside is that one, even though there'll be 1 million doses, this is going to be reserved predominantly for people with comorbidities. You can't give this drug to everyone who gets COVID. And secondly, it has to be given early, within 72 hours of the diagnosis, and it's an IV infusion. So the logistics of setting this up are complicated and not easy. You're going to have to go to an infusion center where they can handle actively infected COVID patients within 72 hours, probably 7 days a week. You can't take a break on a Friday, Saturday, and Sunday because COVID doesn't take breaks on Saturday, Sunday, and Friday. And this is the logistics that has to be worked out. This antibody will be distributed to the states, and then the New York State will be able to distribute it to approved infusion locations that have been licensed to give the treatment.